Back live tonight, Takion in Focus. President Cyril Ramaphosa praised the new Middelburg Hospital in Mpumalanga as a modern state-of-the-art facility. In fact, he says this is what development really is. The provincial government has refuted claims, though, by Action SA that the handing over of the facility is part of the governing party's electioneering campaign. Well, for the latest on the readiness of the province to implement the national health insurance, joined now by Mpumalanga Health MEC Sasekani Manzini. MEC, good to have you, and thank you very much for coming on this evening. A quick squeeze at your third quarter performance report in terms of how the province is doing. It reveals a rather interesting picture. One is that you've got 100 clinics without visiting doctors. You've got hundreds who are waiting on surgeries in hospitals due to a lack of surgeons and specialists. And you've got only 60 working ambulances in service, servicing over 4 million people. Can you explain these shocking numbers and why this is the state of health?
No, thank you very much, and to you, Thabo, and evening to the viewers at home. We can say that in terms of how you started the conversation, you indicated that we built one state-of-the-art hospital in Middelburg. It's not the only hospital that we've built. We've built quite a number of them, and also a lot of clinics that we've built in preparation for the NHI. And if you're talking about the ambulances, you can, if you look at how far we have come in terms of buying new ambulances, where every year we are buying new ambulances. Sometimes they're involved in car accident, sometimes they stay long in terms of services. But we cannot say that in terms of the current status, it's a disaster where our people are not being serviced, because we are able to utilize the resources that we are having in a manner that we understand the geographical spread of our population and our municipalities. So far we can say that we are doing our best in terms of handling the issue of providing quality healthcare services to our people. But indeed, that's why we are saying that we need NHI, so that the resources that are meant for the 5.1 million people of Mpumalanga province does indeed goes to those people, rather than currently where you will have more in private sector while we are unable to provide certain services. But within the very same resources that we are having, we are not complaining in terms of where we will see that people are not getting any service at all. In terms of our indicators, you'll see that we are doing fairly well in terms of making sure that our people does access quality healthcare services in the province.
Let's go back then to where you're starting. It has taken you 7 years to build this particular hospital, the Middelburg Hospital. And if you look at that very same report that I mentioned to you, one of the things that is mentioned there is an irregular expenditure of 115 million rands. Waste management is one of the reasons why there's that irregular expenditure, but the Middelburg Hospital is also a reason why there's that irregular expenditure. Why has it taken 7 years to complete this project?
It has taken us 7 years because also in terms of the 7 years, you must remember that there was COVID-19 and we had to stop in terms of infrastructure at some time. And even when we started, it became difficult to get certain equipment. Like, you'll understand that for a hospital, it's not all the equipment that are in South Africa, you must get it from outside. But we can indicate that one of the reasons why in terms of the irregular is that there were some specs that were not put according to what the hospital should be like in terms of the current status currently. So hence they had to adjust and all that. Hence you had this irregular. It's not an irregular in the form of somebody stealing money, like it will be just interpreted as such, but we can explain in terms of why the irregular expenditure in terms of that hospital. But in terms of the number of years, indeed, it took us a long time. But sometimes you must understand, Thabo, that taking long, it does not mean that we are unable to build. If you give us if you have the necessary budget, we can build a hospital in the expected 2 years, because we don't have the budget. So hence we sometimes prolong the implementation of the budget, because we put budget in the different financial year. But we can't put R1 billion to build one hospital. It means everything else must stop as we build that hospital. But we can say that as a province, using the very same strategy, we managed to build quite a number of hospitals and clinics in our facilities. We are not saying there are no challenges, but we are indeed building state-of-the-art hospitals and clinics in the province that our people are happy with.
Yeah, but I mean, in the same vein, MEC, you are underspending on your grants. I mean, if we look at the National Treasury grant, you spent 63% of that. NHI grant, 69% of that. Human Resource and Training grant, 71% of that. Health Facility Revitalization grant, 68% of that. Why are you underspending?
In other grants, like you'd find that you are unable to attract specialists that will come to the province and assist us in terms of working in the province as well as Mpumalanga. And also in other areas, you'll find most of the time it's human resource. And of course, we are monitoring very closely in terms of spending our grant. And sometimes I know that there's a grant where we must contract GPs, and our GPs don't want to go and work in the rural areas, and that is part of implementation of NHI. So it means that as we move forward, we need to get more people that are willing to go and work in rural province, because in a rural province like ours, it becomes difficult to be able to get and attract such people to come and work and stay there for that matter. Some might come, and within a short space of time, then they go back. I was even giving an example today that some doctors, they refuse to take an offer just because when they arrive, there was no McDonald's. So it tells you, when you might think it's simple and easy to get people to come and work. So we are, of course, working very hard to make sure that the allocated budget that is there, indeed, you are correct, it must be spent. There should not be, by any means, from our side, delay implementation of certain projects just because we can't spend. But in most cases, I can tell you that we were able to spend our budget and we're able to make sure that we deliver service to our people.
All right, let's look at other projects now. You're saying part of the projects that also, I mean, you're saying there are other hospitals that you're building, not just the Middelburg one. The new Wheatbank Tertiary Hospital, what are the delays there?
The new tertiary hospital, we are finalizing it, and for this financial year, because there were certain, remember, you can't, clinical briefs that you must also work together with national, and they must be approved before you start. So, but now we can say that we can, in this new financial year, we can start. But what we normally do, we then put, like I said earlier on, for us to delay projects. So we took a decision during budget adjustment to take that budget and put it at my planning. That is almost complete, so that when we then start with the new Linamalachi Hospital, then we have completed with Mapulani, then we can start with also new Linamalachi. So the delays were in terms of that, but we can say now that we are finally ready to start with Linamalachi Hospital, and it will be indeed assisting our people in that area, because that hospital is an old hospital. Hence, you will see now there are challenges. There was one building of the old building that collapsed, and National is assisting us in terms of renovating it now so that it can be used again.
Yeah. Speaking of the projects and the delays in the projects, the union says that in the situation, of course, that you are well aware of it at the Temba Hospital, right? A business forum came and assaulted members of staff there because they were unhappy about how tenders are being processed. Talk to me about how you are dealing with that risk assessment.
Yeah, no, it's a serious challenge in terms of that, and for our people, I think we need to do more education and awareness campaign so that they understand what is happening at different levels. For example, if you are in a hospital, the budget that they are having, it's not a lot of money that you can go and harass our workers or even think that there's something to benefit out of that. And hence we try by all means. I even said to the supply chain, maybe they need to take a program that they will go to all the municipalities so that they indicate to them that there are certain things that are centralized, that they are not even at the level of the hospital, so that they can, because they will just come and say, we want to supply security. Security in the province is centralized and it's under community safety and security, and they always advertise for a 3-year contract. So if you're a businessman and don't have that information, but however, we don't complain, we take it upon ourselves because it's us who are disrupted. The issue of food, it's a contract that is also centralized, and we get so many service providers per hospital to supply, not something that we can work on a quotation, because they wouldn't say, why don't you do quotations for us to rotate? Can patient be fed with a rotation? Because once, it means every month you must go through the supply chain processes of getting people to come and supply. So I think lack of understanding, but some they do understand, because some people they just influence other people because of their own hidden agendas, because you can't tell me that you don't know that securities, this is how they are being appointed in different levels. So, but of course, we continue to, hence I always say CEOs must also understand that their position, they are also political in their nature. They need to make sure that they work with the community around, they make them understand, and also, but we do have, like in the very same area, there are those things called open days. I went there where we call the community to come and raise their issues. Unfortunately, some of them, they don't come. And when they don't come, the platform that is created by government to interact with the community, then it is not like utilized accordingly. And then after they will come and want to demand things that they know they are not even possible for us to implement as a department.
Yeah. So that was one risk assessment done, and it was a security risk that is, of course, associated with the business forum. But there have been other concerns of safety, Carolina Hospital being one of them, Paul Ntsigiza being another one. I think Shongwe Hospital would have been another one that then made for this call to be made to you to say, do a security risk assessment on all the hospitals, ensure, for example, that the security systems are working and that the security personnel is properly trained. What have you done around those particular issues?
You know, Thabo, you'll be surprised that in other facilities, the security risk assessment that was done, those features were implemented. And my question is that in terms of ourselves and yourself, are we asking the right question? Because do we need an army in a security or in a clinic, or we need just minimum security in general, in a normal situation? And we need to educate our communities. And hence my approach now in the province is that community must play a role in the form of your ward councillors, the municipality, and key stakeholders around the area, because we can't expect our nurses to live in fear just because now we must have a security guard in each and every corner. We must have big guns for us to feel safe. When we know that a clinic is a place where we are expected to go there and when you're sick and you get those services. But that's another discussion. From ourselves, we are not saying there's nothing that we can do. We are continuously, with the available budget in that financial year, putting those cameras and securities. They are there at all times. But we need to take it further and say, let's understand. Because now it's not only Department of Health. You go to school, they go there, they rob teachers, something that before it was not happening. So we need to talk about this as a societal matter so that we deal with crime. Because once crime increases, hence we also, as the different departments and sectors, now we are now supposed to be sitting down. But of course, even over and above that, what we are saying, we met with the security companies and we've agreed that each and every facility they will have, because we learned that they do have a response team. So those response team will now be stationed in one of the facilities so that it becomes easy for them to feel safe. So that's the measures that we've put in place, working together with the Department of Community Safety and Security to make sure that there are some upgrading in terms of security. And also the SAPS, because what we have realized, Thabo and the viewers, is that most of our facilities, they're not far from the police station. So we have agreed that from time to time, they'll be monitoring our hospital and also the nearest 24-hour clinic that we are having. But we are doing something as a province. But also, let's discuss the issue of, let's understand that if you're going to a clinic, you're not going to harass nurses, you're not going to cause any interference, because your interference of 1 second or 2 seconds, somebody might die because people are now scared, making noise, threatening people. So it's something that we must go beyond just the department, but all of us work towards making sure that our nurses and doctors are safe in our facilities.
MSC, I'm completely out of time, but I appreciate you. Thank you very much for coming on and painting that picture. We'll constantly come back to you, particularly when it comes to that quality improvement plans that you're putting in place and reaching the ideal status of your facilities. Much appreciated, and thank you for your time.
Thank you very much. And we can tell you that as a province, we are ready for the implementation of NHI. Thank you.
Much appreciated. That's the MEC there for health in the Mpumalanga province.